What is the role of consumer-directed choices here in New York State?
Right. Well, the Consumer-Directed Personal Assistance Program is an alternative home care program. Nursing agencies hire their own pool of nurses, aides, etc. And what they do is they would send a person to your home to assist you. Based on if you needed simply getting dressed, it would be an aide. If you need more medical things, it might be a nurse. But there's a registered nurse within the home care model who would come to your home and introduce the aide to you, would train the aide, would tell them exactly what needs to be done. For people who are self-directing, like myself, it's a whole different program, the consumer-directed program. You get to recruit, hire, train, supervise, terminate your own home care workers, which means you could hire a friend, a neighbor, you can put an ad in the paper, any type of recruitment, but you get to choose who comes in your home, when they come, how they do things. It's an amazing, empowering situation. I've had many, many, many good nurses over the years of using traditional home care. But it's a very different model of record and report. You don't have the autonomy you would have if you do get to choose who comes in your home, when they can come. An agency may say, we could only have someone come at 9 p.m. to help you get into bed. Who wants to go to bed at 9 at night? You could literally, your neighbor could help you at 1 in the morning.
Right.
You know, it's a whole different paradigm.
Now, you work, Consumer-Directed Choices works with organizations around New York
Yes.
State. Can you explain how someone watching us, say, in Syracuse or Buffalo would benefit from Consumer-Directed Choices?
Great. Well, I am also the president of the Consumer-Directed Personal Assistance Association of New York State.
Which is?
Well, it's our statewide association that has all the different members. Consumer-Directed Choices is a member. So in Syracuse, Enable, which is on Court Street in Syracuse, and in Buffalo, the Western New York Independent Living Center, they also provide this consumer-directed program, so that in those counties that they serve, that if people contact those organizations or their local Department of Social Services, they can ask about the consumer-directed program, because you know, like I said, it's not only that they get to choose their own workers, but the organizations themselves, we operate in such a way that we take on all the, I call it the bureaucracy. We will bill Medicaid, we will facilitate the payroll for the workers, the statutory insurances, workers' comp if someone gets hurt, unemployment if it doesn't work out, disability if someone, you know, trips in a grocery store parking lot, benefits, health insurance. We do all of those things that someone who's a single employer wouldn't be able to do. It's very win-win. But really the most important thing that's relevant right now is that the cost savings to the taxpayer is immeasurable, because the per hour rate for that consumer-directed hour is dollars below the lowest home care rate. It's sometimes $20 or $30 lower than the next higher up rate. And when you look at the fact that if the consumer trains their own worker to do a task that would be considered nursing, you could be talking over $100 an hour savings. And you get to do it on your own time, where you want, how. It's just completely win-win.
Now, you also are able to get people back into the workforce who have gone through similar situations like yourself. How does that work?
Well, you know, the fact that people with disabilities can't, when you cannot control your home and your environment. If you can actually direct your own care, you can begin to build your own self-esteem, you can build your own life, you can actually arrange to go to college and or work because you have the flexibility and autonomy to get out there and do it. Some people with disabilities also work as personal assistants, helping other people with disabilities. Yeah, again, it's very interesting.
Economically, how is one with a disability able to get that additional education, get that person to come to their home, or get that training which provides some employment? Is that through federal, state, and local assistance?
Well, those were three separate things. In order to qualify for a consumer-directed program, you do have to be Medicaid eligible, and Medicaid is a federal, state, local, reimbursement to the provider.
What exactly does Medicaid mean? Because we're hearing it a lot on the news these days.
Yes. Medicaid is considered the social safety net. You have to be extremely, extremely poor to get Medicaid. If you are at the Social Security supplemental disability income, which is only around $700 and change per month, that's it. Try living on $700 a month. You're automatically qualified to receive Medicaid. Medicaid provides acute health care. It also provides long-term care. What's very important to know is Medicare, which is, for seniors, barely provides long-term care. Private insurances don't provide long-term care. People basically need to spend down into poverty to become eligible for Medicaid to receive long-term care, whether it's nursing home, whether it's home care. And that's very important in our culture right now, when everybody's saying Medicaid, Medicaid, it's draining us, it's these entitlements. But it really is about what would happen if you had an injury, what happens as you age, what your mother, your father, your sister, your brother, your neighbor. It's not us and them. It's all about us.
And for one to get that assistance, they go through the Social Security Administration to apply for those programs?
Well, Medicaid itself would be local to each county, county social services, unless you do qualify for SSI. Then that qualification is done through the Social Security Administration. Now, consumer-directed programs, if you are Medicaid eligible, you would have to contact your Department of Social Services, usually the home care units, and if your county has a New York Connects phone number, that would be the place that you would call.
Besides getting a good employee, isn't it beneficial economically to an employer to hire individuals who are in a similar situation like yours?
Well, I'm trying to understand what you're asking.
There might be a tax credit or something?
Oh, yes. I believe that there are tax credits.
Okay, that's what I mean.
For employing people with disabilities.
So the government is encouraging employers to bring folks who might be in your situation back into the workforce.
Right. And it's very sad to note that the unemployment rate among people with disabilities, the last statistic I heard was, it's over 70%.
Over 70%?
70. And
I believe the national right now is about 9%.
Yes. And it's very difficult when people start discussing the Americans with Disabilities Act as special, where it really is only it's a civil rights law that levels a playing field. It's it's not saying that you have to hire a person with a disability because they're special. What it says is you need to hire a person with a disability if they can perform the essential job functions with or without reasonable accommodation.
I'll use the example of the Menands workshop. Isn't there also a state, I'm not sure whether it's a law or an incentive, which encourages people that are buying products to go to situations like the Menands workshop, where people in similar situations like yourself are making products?
Well, there is a New York State, it's called a preferred source statute.
Right.
And with that, there are organizations that do employ people with disabilities to, create different products, and then there are state contracts for those. Some of it can be controversial because their disabilities range through, many developmental disabilities onward up, and there are some people who look at some of the way that jobs are focused on always providing a minimum wage, and sometimes it's difficult because if you did provide a minimum wage for certain folks, then they would not be eligible for Medicaid anymore, and they might not be able to work in the total workforce. But there's been a big movement toward integrated workforces for all people with disabilities.
Now you're working with our federal, state, and local leaders on various issues to make things better for folks with disabilities. Could you briefly, in the few minutes we have left, just talk about some of those issues that you're working on?
I would say the most important issue right now is the state of long-term care in New York State itself. We have a new administration that has come in and created a Medicaid redesign team. And as we've seen with the budget process, many people who had great ideas to talk about the redesign of Medicaid came to public hearings, submitted ideas on the website, and yet what was passed were proposals that basically cut entitlements and slashed the long-term care system and the active hospital systems. And so what remains to be seen is when the budget process ends, where will long-term care actually exist in New York State? How will things pan out? If managed long-term care is mandatory all over the state, what will that really mean for people with significant disabilities? It's a system that has never dealt with people with significant disabilities. It's a system that's an apple and an orange to the model today that looks at your needs. It's based on a per hour because it's one-on-one with home care, and managed care is a rate per person, per across the board, in the model, so that at what point, if there are too many people receiving too much service, they're not going to be able to provide those hours. What does that mean for people with disabilities? We can't have people go back into institutions. That was deemed illegal through the Americans with Disabilities Act and the Supreme Court. We can't have people not being independent and have their freedom.